We welcome Lon Kightlinger, the state epidemiologist for South Dakota. Thank you for joining us, Lon.
Thank you. I'm in Pierre, and I'm in the basement of the Public Health Laboratory, so glad to talk to you.
Great. Let's talk about the flu this year. How are we doing in this state?
It's slow. It's really slow, but it's picking up. This is the slowest and mildest influenza season we've had in 13 years. But the virus is out there. It is making people sick, but it just is not sweeping across the state and making a lot of people sick. Last year we had a bad year, but this year it's been pretty mild so far. Can't predict what's going to happen the next couple of weeks, but so far it's been pretty mild.
What do you think about the rest of the country? Have they had a mild flu season as well?
Yeah, overall it's been mild, but just in the past week or 2 weeks or so, some states have been reporting severe cases of influenza in a few cases. So the virus is hitting some people somewhere, but so far in South Dakota, we haven't had any reports of this severe, difficult to treat influenza.
Right,
so we hope that stays away from us.
Do you think that's because the flu is lighter this year everywhere, or is it because of all the vaccinations we've been doing?
Well, for us, it's two things. We have, as I'm proud to say, we have the highest influenza vaccination rate in the country, so that certainly helps. But we've also got some old viruses circulating. Nothing new on the viral platter this year. And what the predominant strain is good old H1N1, and that's been around for 7 years. And so people are building up immunity to it. People are still getting sick, but it just doesn't seem to be hitting people as hard this year as it has been in past years. Now, I don't know what the next couple of weeks are going to bring. In fact, tomorrow on Friday we do our weekly flu report, and we're ratcheting South Dakota up a notch. We're going up to regional activity status, and that's the second highest. So we're going up with influenza activity in South Dakota. But even so, it's been pretty mild so far.
Too late for the flu vaccine?
Well, it's almost March, but no, the party line is if the outbreak hasn't hit yet, you're not too late. But good grief, Rick. We need to be getting our shots back in September and October because we really don't know when influenza is going to hit us. We just don't know. We can't predict the week or even the month, as we're seeing this year.
What are your recommendations about the pneumonia vaccines, Prevnar and Pneumovax?
Absolutely, get them. The pneumonias, they cause a lot of hospitalizations, a lot of illness in people, and we recommend that you get it. Don't hesitate. Just go in and get it.
Right. And I'm recommending to my people over 60 or 65 and anyone who has lung disease or diabetes that they get the Pneumovax and then a year later get the Prevnar vaccine, or vice versa. But they should get both of those shots a year apart. So what about the Zika virus? Any new changes or new reports?
Well, okay, here's another example of an emerging viral disease, a mosquito-borne virus. Zika, it's actually a very close cousin of West Nile virus, which we in South Dakota have had, we've become well acquainted with. But the difference is Zika is carried by the Egyptian mosquito, and we don't have that here in South Dakota. And I don't think it's ever going to come and live here if the climate stays the same here. But we do have people that travel. We have South Dakotans that travel to Mexico, the Caribbean, parts of South America, and it's making people... Actually, the disease itself is milder than West Nile. With Zika, you don't have the encephalitis, you don't have the meningitis, you don't have the deaths and the hospitalizations like we see here in South Dakota every summer. But what's bad about Zika is it has been strongly linked to birth defects. And I guess the one that's been in the news the most is microcephaly, babies born with very small heads. And that's what makes Zika so scary.
And we've had cases. Is it because of travel or because of sexual transmission? What do you know about that?
We've had cases in the United States, but not acquired in the United States. It's been cases among people who have traveled to the Zika zones, most places in the Caribbean, Mexico, and South America, and then they've come back. In South Dakota, we've tested a couple dozen people now, mostly pregnant women who have traveled, and none of ours have come back positive yet. I see that Minnesota and Nebraska, our neighboring states, have had positives, but that doesn't mean it's transmitting there. In fact, we do not expect it to be transmittable in South Dakota or any of the northern states. This Egyptian mosquito, it is found in Florida, in Texas, Louisiana, parts of California, Hawaii, some of the hot states, but not this far north. So we really do not expect local transmission.
Are there other issues that we should talk about as far as public health in South Dakota?
Oh gosh, there's so many issues, Rick. I guess we could just talk for hours on them. Some of the things that we're working on, that we're perpetually working on, are like the obesity outbreak, tobacco, cancer, getting people more active, just lots of different issues, keeping our vaccination numbers up, like the meningococcal vaccine that will now become a middle school vaccine in South Dakota. The legislature just passed that, so we're pleased to have that. We've got our old standby diseases that we're always fighting, and then things like Zika, that just comes literally out of the blue, and we have an emerging virus. A year ago, I would have had to go to my books back here to find even the smallest little half-sentence paragraph on Zika virus, and now, we're just spending all kinds of time on it and effort on it. So,
Lon, do you have any take-home messages for the public?
I guess since influenza has been so unpredictable, and that's what we started this talk with, I just want to remind people that influenza, even though we're getting close to March now, it's still a threat. Wash your hands. If you haven't gotten vaccinated yet, you've still got a chance to do it, even though it's late. And if you're sick, stay home. We've got lots of other respiratory diseases out there. We're having spikes now in RSV, which really affects children. Stay home if you're sick. Wash your hands. Use the hand gel. Take care of yourself. I guess that's our recommendation for this week.
Thank you for joining us, Lon, and take care of yourself.
Thank you, Rick. Thank you.